Did you know that over 131 million Americans, which is about 66% of adults, take prescription medications? But of course, many do not address the root cause, and that's actually studied according to the Mayo Clinic in 2022. So, my question to you is, are you treating symptoms or are you addressing the root cause? If you're new to my channel, welcome. My name is Dr. Erica Steele. I'm a board certified naturopathic doctor. I hold 7 degrees in my field, all in the natural healthcare space. I like to say that I went to school, so you don't have to. However, most people are in school with me. So I am your professor for Intro to Holistic Medicine. And so this is week 4, and this is part of our class. If you're new, you can register. It's completely self-paced, so definitely feel free to jump in whenever you find this video. All right. It also too, we have morning flow, 6 a.m. Eastern Standard Time. And then we'll talk about some other classes that we have for this week coming up, such as we'll be on a panel for 100 Packs. He has a YouTube and TikTok channel. So we'll be on the panel talking about holistic health with other amazing panelists. Also too, my lunch and learn topic for this week on Thursday at 12 p.m. is going to be stress management. So definitely check it out live or register in the link below. All right, so let's talk about symptom management versus causative treatment. So when we're treating symptoms, it's highly reactive. We're masking the symptoms. We have symptom after symptom, and then we go, oh no, I have a headache. Let me take the headache medication. Oh no, I need a painkiller. Oh no, I need a steroid. Oh no, I need an acid reducer. It's when we're reaching for something to fix a temporary problem. And so we can actually do symptom management even in natural medicine when, that's what alternative medicine is called. When you are, instead of taking, let's say, your Prilosec, you're taking HCl, right? But you're not actually repairing your diet. You're not actually drinking more water. You're not taking more minerals, so you're not really actually getting to the causes. You're just managing all of the symptoms. So it's a bit of a whack-a-mole. So in causative treatment, we had to take a step back. We're far more proactive, which I think can be a little, challenging sometimes for patients because we are used to and we're all programmed in that conventional symptom management, diagnose and manage model. And so in causative treatment, it's much more relaxed. We're much more observant. We're not as reactive when a symptom comes in. We're actually more meditative and we're paying attention to, where is the symptom coming from and what's the real reason behind the symptom? Is it something I ate? Is it, something I was exposed to? Is it, an emotional component? Is it, pick a thing, right? Gut health, stress, toxicity, right? Adrenals, all the things, right? However, a lot of these things, again, have a lot of causatives, and causative isn't just this one isolated thing. I know conventional medicine, again, in that symptom management, they teach us like it boils down to one diagnosis. So people are always looking for that one diagnosis, that one label, that they can wear. But when causative treatment, it's usually, this happened, then this happened, this happened. It's like a story, right? So maybe like you got stressed, at work, and then you got, your schedule got kind of all wonky, and then your child got sick, and so your food went out the window, and then you're ordering food, and then you're on that cycle, and then you find yourself getting into that pattern, and then you're gaining weight, and you're having acid reflux because of the food choices, and again and again and again and again and again. So, life is lifing, right? But it's important to take a step back. That's why we really emphasize more of, more meditative and more relaxed feelings. So another example is if you have chronic acid reflux, right? And so most of the time in symptom management, they say take an antacid, right? But we know that that only suppresses acid function. So causative approach asks, why is the acid reflux happening, right? And so again, we go, okay, let's check our pH levels. Let's look at, do we have low pH? Do we have high pH? Are we acidic? Are we alkaline? What have we been eating? We start, how much water have we been drinking? Again, how much minerals have we been taking in? All of those questions we are going to begin to ask. And then as we ask those things, we're going to check them off like a checklist. So we say, okay, I have this symptom like acid reflux, right? What are some of the causatives? Not enough water, not enough HCl, not enough stomach acid, et cetera. And so we're going to go, okay, I'm going to drink more water. I'm going to, drink better water today. I'm going to add more minerals to my water. I'm going to add some electrolytes to my water. I'm going to add some greenery. Maybe I'm going to do some green powders, like a green smoothie in the morning, kind of to start my day with some protein, right? And then maybe I'm going to drink some ginger tea with every meal. And then I'm going to focus mainly on more of my alkaline foods and less on my acidic foods, And so those are the things that then accumulate over time, right? And so again, we can't keep looking, is the water boiling yet, right? We can't keep looking. We know that health, it builds consistently, deliberately over an extended period of time. And so as we begin to make these changes and we begin testing and reflecting and testing and reflecting, and we begin to see patterns, we begin to really isolate out what those true causes are. So for instance, right, I would get lots of bloating, right, at times. And so I had to really determine what I was eating, and I pinpointed gluten, right? My body does not like gluten. It'll make me bloated. It'll make me gassy. It'll make me itchy. I used to have an assistant that used to eat, she would eat gluten, she'd have a reaction too. And she'd be like, look, I've got my gluten baby, because sometimes inevitably life is lifing, you're at an event, something going on, you get exposed to it. And so things happen, but it's knowing what to do, which we'll get more into as we get deeper into part 2 in Intro to Holistic Medicine, which is more about the modalities. So again, definitely come and check us out. Any of the classes that we have this week, all of the classes, if you don't catch them live, are available via registration. So links will be below. For our stress management class, I think 100 Packs does his live. My morning flows are live, but there's replays available for those. You don't need to register for anything for that. And then, of course, if you want to be a part of Intro to Holistic Medicine, we are in week 4. You're more than happy to jump in here and go and then circle back. Or you can start from the beginning. So whatever works for you, I'm looking forward to teaching you and your family more about how to live naturally.